Hello, I'm here to talk to you about the two different kinds of cancer pain most patients experience, persistent pain and breakthrough pain, and why it takes two different types of medication to manage them. If you have pain that lasts all day, we call that persistent pain. Your doctor has prescribed a long-acting or around-the-clock medication to treat this type of pain, and he or she has probably already adjusted your dose to reduce side effects such as sleepiness or confusion. However, no matter how effective your around-the-clock medication is, you can still experience sudden severe pain flare-ups, pain that breaks through the around-the-clock medication. This is called breakthrough cancer pain, and traditional medications for persistent pain are not designed to treat these sudden flare-ups. If breakthrough cancer pain is treated by increasing your daily dose of around-the-clock medication, you may suffer the typical side effects of traditional medications called opioids, constipation, sleepiness, and confusion. The goal in managing breakthrough cancer pain is to give just enough medication to manage the pain as soon as possible while minimizing troublesome side effects. When you are prescribed medication for breakthrough cancer pain, remember that it is important to continue taking your around-the-clock pain medication every day for your persistent pain. Actic is a very specialized medication. It is to be used only by patients with malignancies who have breakthrough cancer pain and who are already taking an around-the-clock opioid medication such as Dosage, Dilaudid, methadone, morphine, MS-Contin, or OxyContin every day for their persistent pain. If you are already taking an opioid medication such as one of these for your persistent cancer pain, and your doctor says that you are opioid tolerant, then Actic may be right for your breakthrough cancer pain. It has been available for years now and is being used by thousands of patients like yourself today. When you take your Actic prescription to the pharmacist, you will receive one or more of these individually wrapped Actic units. There are 6 different dosage strengths of Actic, all color-coded for safety. Your first prescription is for a starting dose. Depending on how well that works, your doctor may switch you to one of these other dosing strengths. Along with your prescription, you'll find this patient leaflet with important information. Read it first, and if you have any questions, be sure to talk with your healthcare provider. The Actic units are individually wrapped in child-resistant blister packs. Do not open a pack until you are ready to use Actic. Patients should know that Actic contains a medicine in an amount which can be fatal to a child. To open the unit pack, find the end that says "Cut to open" and turn it over. Then cut straight across the stepped edge, right here. Now carefully pull back the paper and remove the unit by the handle. Don't try to push it through the packaging. Actic must be kept safely away from children. This Actic welcome kit, which contains a copy of the patient leaflet that comes with every prescription, is designed to help you do just that. Be sure to read and understand the patient leaflet before you use Actic. It is important to remember that Actic and your other medicines must be stored in a locked storage space. Once you have chosen a safe place to store your Actic, you can use these child-resistant cabinet locks to prevent opening. When you leave the house, you should use this portable locking fanny pack to carry as many Actic units as you will need. Actic is a unique way of delivering medication into your body. Instead of a pill or injection, Actic uses a lozenge about the size of a cough drop on the end of a handle so the medication can be directly absorbed into your bloodstream through the lining in your mouth. Here's how it works. Place the Actic unit into your mouth between your cheek and gum and actively suck on the medicine. At the same time, you should move the medication along your cheeks as you twirl the handle. Never bite or chew on the unit. As you move the lozenge in your mouth, some of the medication will be absorbed directly through the lining of your cheeks. The remaining medication will be swallowed and slowly absorbed. As soon as the drug enters the bloodstream, it is carried throughout your body, including your central nervous system, the brain and spinal cord, where it works to relieve your pain. Plan to finish the Actic unit completely in 15 minutes. If you finish Actic too quickly, you will swallow more of the medicine and get less relief. Many patients use a clock to time themselves so they can finish within the recommended 15-minute dosing period. When you use Actic, pain relief may begin in 15 minutes. It may even begin while you are taking Actic, but you may not experience full relief for up to 45 minutes after finishing the Actic unit. If for any reason you cannot finish an entire Actic unit in the recommended 15-minute dosing period, you should put the unfinished unit in this temporary storage bottle for safekeeping. Partially used Actic units may contain enough medicine to be harmful or fatal to a child or other adults who have not been prescribed Actic. Even if you finish the unit, you should put it in the bottle as well. Then, when you get home, take the used and partially used units out of the bottle. Hold the partially used units under hot, running water until the medicine is gone. Then throw all the completely used units away, out of the reach of children and pets. In the Actic Welcome Kit, you'll find various items to help you manage your breakthrough cancer pain most effectively and safely, including emergency information stickers, a patient diary, and a patient leaflet that you should read for important information. Be sure to ask your doctor, nurse, or pharmacist for a patient welcome kit, or call Cephalon Professional Services at 1-800-896-5855. With Actic, the moment pain begins to break through your around-the-clock medication, you can start to consume your Actic unit. The lozenge has a mild berry flavor, and the unique delivery system can be used anywhere. A serious side effect of Actic is slow, shallow breathing that can become life-threatening. This can occur if your dose of Actic is too high or if you take too much Actic. You and your caregiver should discuss this side effect with your doctor. With Actic, the most common side effects are feeling sleepy, sick to your stomach, or dizzy. If you begin to feel very sleepy, remove the Actic from your mouth or call another person in your household to help. So, now you have it, right in your own hands, the potential to help manage your breakthrough cancer pain with Actic. Remember, it's the only medication approved by the FDA for the management of breakthrough cancer pain. Important warnings. Please listen to the following important warnings. They are also provided with every prescription of Actic. Actic contains medicine that could be harmful or fatal to a child. You must keep Actic out of the reach of children. Explain to children that Actic is a medicine for your use only. Your doctor or nurse will instruct you on how to keep Actic out of the reach of children and how to discard open units properly. See how to store Actic in your home and how to dispose of Actic after use in the Actic patient leaflet. Actic can cause injury or death in people who are not already taking prescription opioid or narcotic pain medicines on a regular schedule to relieve persistent cancer pain. If you have not been taking these types of medicines, do not use Actic because it may cause your breathing to slow down to a dangerous level or even to stop. Some examples of opioid pain medicines are Duragesic, Dilaudid, methadone, morphine, MS-Contin, and OxyContin. Actic must only be used for breakthrough cancer pain, and only in people who are already taking and who are tolerant to prescription opioid or narcotic pain medicines on a regular schedule to relieve persistent cancer pain. Do not use Actic if you have pain that will go away in a few days, such as pain from surgery, from doctor or dentist visits, or any other short-lasting pain. You should ask your doctor if you qualify as opioid tolerant. Do not let anyone else use Actic. It is for your use only. Here's what you should do if someone accidentally takes Actic. If the person is not awake and alert, call 911 or call for emergency help immediately. If the person is awake and alert, call Poison Control at 1-800-690-3924. Warning: This product may be habit-forming. Before using Actic, please read the patient leaflet. Patients may begin experiencing pain relief while taking Actic, but may not experience full relief for up to 45 minutes after finishing an Actic unit. Actic is indicated only for the management of breakthrough cancer pain in patients with malignancies who are already receiving and who are tolerant to opioid therapy for their underlying persistent cancer pain. Because life-threatening hypoventilation could occur at any dose in patients not taking chronic opiates, Actic is contraindicated in the management of acute or postoperative pain. This product must not be used in opioid non-tolerant patients. Patients considered opioid tolerant are those who are taking at least 60 milligrams of morphine per day, 50 micrograms of transdermal fentanyl per hour, or an equianalgesic dose of another opioid for a week or longer. Patients and caregivers should be aware that Actic can be fatal to a child. Keep all units from children and discard properly. The most common side effects observed were somnolence, nausea, vomiting, and dizziness. Actic is intended to be used only in the care of cancer patients and only by oncologists and pain specialists who are knowledgeable of and skilled in the use of Schedule II opioids to treat cancer pain.